Welcome back to the pod. I think we need to bring this back into season 2. I like when we sing.
Yeah.
Welcome back to the podcast. I'm your host, Madison.
And I'm your host, Alexis.
Oh, you don't even know what podcast this is.
Skinscape Aestheticians Unplugged.
Yeah.
Today we are chatting about microneedling.
Oh my gosh, she's having a stroke. She has 3 drinks on the go, so you would think that her brain is working at full capacity
this
right
one's full, so that's the issue.
now. Oh, that's the problem.
We're talking about microneedling versus ultra laser. I think this is a really cool episode because we love microneedling and we love ultra, but they work similarly, but they are different and they pair very nicely together or by themselves or with other treatments. So we really love it. And also sometimes I think it's hard when we talk about like the names of the treatments, like ultra potenza, like people are like, what the fuck does that even mean? Like, I don't know what an ultra is or who or what.
Yeah.
So
what
are
country she comes from?
Yeah, who's ultra?
Who's ultra? Yeah, I'm excited to talk about ultra versus microneedling because in our minds they are very similar in like what they do, but 2 completely different modalities. Fascinating.
I think for that to happen, for that to begin, we must go back and discuss how each treatment works.
Yes.
And what it's doing for the skin.
Yes.
Yeah.
So in the 1800s, laser was created.
Oh, God.
No. Okay.
I think you should talk about ultra because I think it would be kind of cool to touch on what you're doing with the ultra.
Oh, cool.
Briefly, because you are doing all of it. So I guess I'll start with microneedling then.
Yeah, hit me up.
We have 2 different forms of microneedling. You have RF microneedling and you have regular microneedling, but the purpose of that is to stimulate collagen production. So what we're doing is we're creating little micro injuries and your body rushes to heal it by producing more collagen, elastin, all of that stuff. It's really good for, I would say, global rejuvenation. If you are looking to target multiple things, it's really an umbrella treatment where everyone can benefit from it. There we go. And everyone can benefit from it.
Accurate.
Real. It's also really good for scarring. We can treat any skin laxity concerns, jowling, double chin, like all the things.
It also depends on your skin's age because like we can have 50-year-olds come in and their skin age like looks fabulous, like it's like 30 and they don't necessarily need a potenza treatment. So
yeah,
everything is based on your skin.
Yeah, it really is unique to each person. It's hard to kind of generalize these things, but just to give you like an idea.
Totally.
That's what we do microneedling for. So typically when I see someone in clinic that is suffering with acne scarring, they are frustrated by jowling, or they're like, I just want to do a treatment, I want to look good, like microneedling for sure.
I love microneedling.
Yeah.
And I love that you can infuse any topical with it.
And I love that like regular microneedling is very easy.
Yeah, it's so easy.
It's like I have a low pain tolerance and I can tolerate
20
it.
minutes numbing, microneedling.
Yeah, and Jess does it without microneedling.
Or without numbing. Yeah, because she is crazy.
I kind of want to try. I think I could handle it.
I can't.
Really?
If I can't handle it, you can't handle it.
Okay, perfect.
We know this. I have a higher pain tolerance.
Yeah, very much so.
It's not that much higher. Whoa.
Zola.
It's bill time. Anyway, let's get into ultra. So we love the ultra laser. honestly, when we were first getting the ultra laser, I remember having a discussion with Jess and being like, why do we need this device? Like, what is this device going to actually do for us? And why are we adding it to our portfolio.
Yeah.
Oh, wow. Repertoire.
Madison loves my vocabulary. She basically does that every time I say something.
Yeah.
Or Jess.
It's
but
so
Jess
true.
is even crazier.
Yeah, it is. Hers is wild. We should honestly just get Jess on here just to spew
Say
her.
fancy words.
Yes. Tell us the description of them. It's like
But
a spelling.
it's so funny. She said a word, and then it was in my book, the one that you were wild about, and you brought it up to me, and then literally
I can't remember.
Like, a couple days later, it was in my book, and I was like, "Shut the fuck up! I wouldn't have known this word if it wasn't for Jess. I would have had to click the Kindle dictionary
what does
thing."
this word mean? That's so funny. Okay, so I remember when we were getting Ultra, and her and I had the discussion of like, okay, well, why do we need this device? Like, it's not looking for browns, it's not looking for reds in the skin. Like, what is it actually doing? But we had to get more knowledge on it.
I kind of thought it would be redundant as well.
Right?
Like, I was kind of like, oh, okay, like, cool.
Expensive for a singular treatment with it. What is it going to do for us? The Ultra Laser, it's a 1927. Yeah. And it sees water in the tissue, which is actually very, very cool because it doesn't see pigment and it doesn't see reds. So you can use it on any skin type because it is targeting water in the tissue. So
and lasers typically have 3 targets, whether it's pigment, like she said, hemoglobin, or water.
Yeah. So this laser creates microchannels in the skin using the thulium laser. So it's using heat to create these microchannels. And these channels stay open for 4 to 8 hours. Similar to microneedling, it's creating these channels in the skin, but the wound stays open for a lot longer than with microneedling because those collagen, elastin, fibroblasts are sending directly to it to heal it right away.
Yeah, people don't understand, like, your skin is very, very smart.
Yeah.
And it works literally to protect you from outside elements. So,
yeah, it's a defense mechanism for all of your organs.
Exactly. So when people are talking about, like, products penetrating the skin, stuff like that, like, it is actually very hard, and your skin is more receptive to things that it naturally produces.
Yeah, so your body needs to understand it for it to be able to process it and be like, oh, I get what I'm supposed to do.
On through.
Yeah, exactly. So creates these channels, 4 to 8 hours that they stay open. So again, we can do a lot of topical penetration with it. And that kind of goes into like what I'm doing with the Ultra Laser. We're doing a lot of hair restoration trials right now. Creating these channels, putting topical serum on, using LED light, and hopefully stimulating some hair follicles.
Yeah. The nice thing about Ultra is it's different from microneedling in the sense that you can go that extra mile with your customization. When I talk to my clients about Ultra, you can go very, very light, and I would think of that as just like a light dusting, like a polishing, if you will.
Yeah, it's kind of like a dermabrasion.
Yeah, like just
scratching the surface.
Just a polishing. That's really a polishing. So when we do it after our Potenza and stuff like that, generally the settings of the Ultra are pretty low. One, because we've already been aggressive with another either laser or some kind of treatment, but we're really just like dusting the surface, so polishing it, one, so that our topicals are penetrating, and we're also resurfacing the skin. So when we combine it with other treatments, I like to think that we are treating the skin at multiple different layers for the best outcome. And the nice thing about it is not only can we do that, light dusting, that polishing, we can also power wash the whole damn house down and be really, really aggressive. So they have the 20/20 method where it isn't an ablative laser, but you can get pretty similar results with that treatment. So it's very versatile. We can do melasma with this device as well. We can do acne scarring, like Madison said, hair restoration. It's really everything. You can treat on the lips with it.
Oh, it's great to treat acne, active acne,
which we
love. We don't have a lot of devices that can treat active acne. We have chemical peels.
Mm-hmm. And when I was at my previous place, we had the like laser genesis we would use quite frequently to kill bacteria on the surface of the skin. So there are a few devices out there that treat acne, but I would say not many. Who is a candidate for each of them?
Anyone and everyone.
Yeah, really, like very much so.
Except for active acne with regular microneedling.
Yeah, I know this is interesting, and I think that we should do a new
episode on this.
But I know that this is a very hot topic in the industry right now, and there has been some people that say microneedling does help with active acne and that you're not spreading the bacteria, blah, 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 blah. I don't care what you do. That's fine for you and your patients. Maybe I'm a little bit old school in the way that I think. Again, we've been doing aesthetics for a while now, and I would just like to stay with how I am treating. I've gotten really good results for me and my patients in the way that I treat. And maybe in the future, if things continue to change or there's more studies or whatever, sure. I'm always open to learning. I mean, we learn new things on a daily basis, but I just like to stick with what I know works, and not microneedling over active acne works.
I will
for me.
never microneedle over active acne. I don't know how to break it down so it like is super, super clear, but like these little tiny needles will go inside the pimple where there is pus and bacteria, and it's jabbing, and it goes very, very quickly. And then you're going to microneedle over the rest of the skin where there is no active bacteria present and spread it. It's like...
No, I get it.
It's like playing with turkey or chicken and then licking your fingers.
Jesus Christ. Okay.
Like, how do I make it clear?
The thing is, and I totally agree with that because, again, I think I'm very old school in the way that I think. But I've read a little bit about what people are saying about this. And the one girl that talks about it very frequently essentially says that you are not spreading bacteria because that bacteria is always present on the skin. Not necessarily true, because the cause of acne is the presence of the C. acnes bacteria, which was previously the P. acnes bacteria. But
we just like to change things up in this industry.
But again, if there's always things changing, and I'm totally on board with learning different ways, but I'm not on board with that one.
No, I'm not on board with that one. And I think that if you have other modalities to treat active acne, then like why not go for it? Because like you can go over active acne with the ultra laser and then put a topical on it, because it's not creating an injury with needles.
And not only that, like a lot of people that we see are more aggressive grades of acne. I would say we do see, the 1, 2, but we do see 3, 4 as well. And if we're seeing someone that has a lot of inflammation and stuff like that, it's going to be very, very painful for them. So I couldn't even imagine wanting to start microneedling over someone that has pain in their face already, right?
Yeah.
So yeah, not for me, but whatever. What do we know?
Yeah. True. You're right.
What do I know?
Okay, so let's talk about the healing process of both microneedling and the ultra laser, and then I kind of want to talk a little bit more about the 20/20 method with ultra.
Yeah, talk to us about the downtime for the treatments.
Okay, I'll talk to you about the ultra laser if we're doing that individually. Sometimes it depends on the patient, but I'm gonna think of my one patient right now. We're treating overall skin texture and some pigmentation.
Are you doing ultra alone on her?
Ultra alone on her. So we did IPL and ultra, and now we're just doing ultra, and she's had great results. But She's coming back in next month because we skipped the summertime a little bit because she was away. And when she comes in, we do about 20 minutes of numbing because I do go more aggressive on her, and I do 15 joules. Yes, and 4 passes on her with the Ultra.
How's that?
She's spicy, but she's okay during it. And she's had phenomenal results. Like, her skin looks amazing. She even messaged me a couple weeks ago just saying, like, I'm so happy with the results that I've had, and even going throughout the summer and not doing anything but being on Illuminate. She's very, very happy.
Oh, that's great.
So with it's a more aggressive approach with her because we do numb. I would say her downtime for redness is about 4 hours, sometimes 6. And then next day she's feeling a little bit dry and crusty, and you can feel that like sandpaper texture. The sandpaper texture on the skin lasts for about 4 days, and then it sloughs off around day 5. With the sandpaper texture, nobody can actually tell that you've had a treatment done. Like, you can't see it unless you're right
like
up to their
grill.
face. Yeah. But you can feel it when you're washing your face and doing your skincare routine. And like, you may have some like peeling, flaking at day like 3, 4, maybe 5. But other than that, like, you're not red for very long. You're not blotchy. I would say it's light work compared to microneedling, but even microneedling is pretty light.
Yeah, it depends on, because I've seen some crazy post procedures of the microneedling other people are doing, and the downtime looks crazy.
Yeah.
If you come to me, you're never gonna leave looking like that.
No.
Bloody and open wounds. But I would say for the most part, for both of them, like, you may feel definitely hot, like that sunburny feeling, and it goes away very, very quickly. But other than that, you may have a little bit of redness, swelling, usually goes away within 24 to 48 hours, depending on the sensitivity of your skin.
Yeah.
It's very easy.
Yeah. I always find with microneedling, I'm just like...
You stay red longer.
I do, but I'm very, very fair.
Yeah.
And also, when we're doing treatments on each other, we're very aggressive.
Yeah.
We like to push the boundaries to see how far we can actually go without doing it on our patients first.
Yeah.
Which I think is actually very nice of us.
And also, I'm just like, if adverse reaction were to happen to me, like, I don't really fucking care.
Yeah, we'll fix it. It's fine. But I get really dry and flaky around my mouth and my nose, but that's with every single treatment.
Yeah.
I find, like, again, everyone's skin is so different, so you're gonna have different reactions, different results. You just have to be aware of that.
Talk to us about your trial that you're doing a little bit. I mean, this could also be its own episode, but just kind of, because I think a lot of people don't really know the options. And the reason that I like it, though Madison will go into it a little bit, is the way that Madison is doing it takes away from having to pair. Usually you do hair restoration with PRP, and while PRP is great, there's a lot of factors that go into it individually, like the health of your blood. So the way that Madison's doing it takes that away completely, 1, and 2, if you're like me and you're scared of needles, then you don't have a blood draw, and that's great.
Yeah, so for the hair restoration trial, we're doing a couple different topical serums with it. One is exosomes, one is Carafactor. We were going to do PRP, but then we decided to not do PRP because, again, it is based on your health individually, and you just may not be that healthy. So we're doing that, and then Corey and I are going to do the whatever the heck it's called. Whatever, I don't care. Something like that. So yeah, it's very, very quick. I have my patients come in. It doesn't hurt. The settings are very low on it. We just want to create little tiny holes so the serum can go in and penetrate.
And this one, we do want to make sure that you are a candidate. So you can't come in Mr. Clean.
Yeah.
But if you do have a receding hairline or hair thinning, that means follicles are still there and still present, and they might be a little bit leggy, so they just need to be stimulated, which is why she's using the Ultra. And then again, when we use the Ultra, we are it allows us to apply a topical that's going to penetrate deeper and work more effectively.
Yeah, I have like 6 patients doing it right now. A couple men, a couple women, and everyone's been okay with the sensation so far.
And you do it every 2 weeks?
Every 2 weeks. I would say I have about 3 patients right now who are going into their 4th treatment either this week or next week, and they have little tiny baby hairs.
But they have them very quickly. I feel like it's after the first or second treatment,
yeah.
Madison was like, look at these sprouts.
Yeah, they have little tiny baby hairs. Like, it's not like a bushel of hairs, but there's like a couple little small ones, which is great to see. Like, that means that it is working.
Yeah, our hair restoration queen.
Yeah, it's so much fun, and it's a very quick, easy treatment. It's like zap, 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 zap. Put the topical on, put them under LED light, and it's beautiful. Beautiful.
Cool.
So
I love that. So yeah, a non-surgical option. Also, it pairs really nicely if you are someone that has had a hair transplant and you're looking to maintain those results. But again, if you're not necessarily ready to go to Turkey yet, then you can try this option.
I don't think I'll ever be ready to go to Turkey.
I kind of want to go to Turkey. I've heard maintenance there goes crazy. Like, maybe I'll get a weave.
Ooh.
Maybe I'll get, like, some veneers. Actually, no, I like my teeth, but my bottom teeth are kind of jacked.
Okay. So, maybe next episode will be in Turkey. Who knows? Jesus.
Mrs. Worldwide.
Yeah, Mrs. Worldwide. So that's...
And you wanted to talk about 2020.
Oh, yeah. I want to talk about 2020. Also, I want to talk about how, like, Ultra can pair with absolutely anything. Anything. You can do Ultra after any treatment, which is beautiful. We love that. We love multi-modalities. You get the best results. But we are going to do the 2020 method with the Ultra laser on me. I'm very fair, so it's easier to do more aggressive treatments on me, and you use me as the test dummy, basically. I also have a higher pain tolerance than Lex, so
okay.
Yeah.
I don't know if you'll be able to handle 2020 because you could barely handle 10.
It's hot. You couldn't handle 4.
It was 6.
Yeah, okay. It's spicy. But 2020 is basically like we're blasting the skin.
Yeah, that's the power wash the house down.
Yeah, like we can get pretty. I think we can get pretty ablative.
Yeah, it is not an ablative laser, but we can get the results of an ablative laser.
Yeah, we can get pretty ablative. That's what I mean by that. Yeah. Especially like imagine doing 6 passes.
Jesus Christ.
I think we'll start with 4. But...
No, I think we should just balls to the walls. Like,
really?
If we're gonna
watch
do
my
it,
face swell right up.
Yeah, it will for sure.
Oh,
you know how I get.
Yeah.
And you're like, ooh, this is scary.
Yeah,
like, that's definitely how you're gonna be.
Anyways, we're gonna document it, see how it goes, and then
we're in our like trial experimentation phase because we have all of these like amazing devices that I feel we're not necessarily using to their full potential. I mean, granted, we get beautiful results with what we do, but there's also other things that they can do that we haven't really tapped into, like even the Ultra on the lips and stuff like that. We haven't really done any of those treatments, and it's just cool to like see the different ways that you can tend to the skin.
Totally.
Yeah.
So what's your question of the day? We're gonna go into it.
Question of the day. This is not related, but if you could swap lives with any celebrity for a day, who would it be?
Oh, who is what is her
Kid Rock?
name? No.
Sheryl Crow?
No. You're an asshole. What is the girl's name where she's the Princess Diaries? What's her name?
Anne Hathaway?
Anne Hathaway. She's so graceful and lovely.
What is she even doing these days?
I have no idea. Maybe making Princess Diaries 12?
I would definitely swap with either Kim Kardashian or Kylie Jenner.
Really? I was thinking Khloe Kardashian because she just don't give no fucks.
She doesn't give a fuck, and like I just want to I mean, I don't think I have the work ethic that Kim Kardashian does.
I don't even. She's psychotic.
Like, she wakes up at like 4:30 or
works
earlier.
out.
Like, okay, I work out, but like, I feel like she does the most. I just want to see.
Yeah, what it's like. Be a fly on the wall a little bit.
Yeah, and also she's hot.
Yeah, she is.
I mean, she's done all the things, but like, she's hot.
Imagine being Kris Jenner.
And she was hot before she did all of those.
Yes.
I would also dabble in Kris Jenner. Like, she just drinks fucking martinis every day, and I love a dirty martini.
T.
Okay. So like, comment, share, subscribe. Thanks for joining us. Let us know. We want to like start doing new things on Instagram, maybe some kind of like reoccurring series. So let us know what you are interested in.
What you want to see.
Hobbies are usually like drinking, and skincare. So let us know. Something that, you know, falls into those.
Yeah, something that aligns with our values. We would appreciate that. Also, what celebrity would you guys want to be for the day?
Yeah, let us know.
I want to know. So like, comment, share, subscribe, and join our email list.
Bye.